Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over some of the top questions I get when it comes to knee replacement surgery. Before I jump into that, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So these are really a list of 14 of the top questions, the big questions that I get when it comes to knee replacement surgery. So this is someone either before surgery, kind of in the process for preparing for surgery, or you may be recovering as well. And I'm just going to give you kind of my couple sentence answer to each of these questions. And if you really want to dive deeper into these questions, be sure to check out some of the other videos on our channel. So let's get started. So first, who is a candidate for knee replacement surgery? So I think of kind of two main things when it comes to knee replacement surgery. First is, what is the extent of your symptoms? So how much do you have knee pain? Do you have stiffness? Do you have swelling? Do you have issues with the alignment of your knee? How long have these symptoms lasted? And the big one, how much does this impact your function, your mobility, and your quality of life? If it is significantly debilitating and causing you lots of issues and lots of difficulty, then that's definitely when we want to consider what we can do to alleviate that, potentially a knee replacement surgery. The other big thing I want to think about is, have you tried the conservative treatment options that are out there? So if that's just activity modification, physical therapy, physical activity and exercise, maybe you've tried some cortisone injections or some of the gel shots or viscosupplementation. Think of the more conservative treatment options out there, as knee replacement surgery really should be that last resort. Because unfortunately there are some risks involved with knee replacement surgery. It's not a perfect surgery, even though it can be very beneficial and very helpful for a lot of people. So you really want to make sure you are considering all the conservative treatment options first, and that your symptoms are at a point where they are really impacting your quality of life. Second question, is there a best age for surgery, for knee replacement surgery? So I would say there's not necessarily a best age. We do try our best to wait. Some people can be pretty young, and knee replacement surgery does have a lifespan. Your prosthetic, your knee replacement does last for only a certain number of years. Now this timeline is getting longer and longer, it seems. Initially we thought maybe it was like 10 years was kind of the average. Now we're up to maybe 15, 20, maybe even more than that is people with knee replacements that last that long. But you want to think about, if you're on the younger end, what can I do to delay knee replacement surgery as long as possible? Kind of the average is around 50, 55 to get a knee replacement surgery. But again, there's a lot of variability, and part of that is now we have, minimally invasive surgeries, we have partial knee replacements that may be appropriate for people who are a little bit younger, a little bit more active. So there isn't really a significant range when it comes to the best age. But, on average, folks who are kind of in their 50s, give or take 5 or 10 years, that's kind of the sweet spot, I find. But definitely people who are much older, and in some circumstances, people who are much younger end up having knee replacement surgery. How can I prepare for surgery? So I think of three main categories when it comes to preparing for knee replacement. One is physical preparation. So doing some physical therapy, some prehab, to work on your range of motion, so how much you can bend and straighten your knee, working on your strength through your quadriceps of your thigh and all the muscles of your leg and body, and that's just going to help your mobility and help you recover more efficiently afterwards. The other thing we want to prepare is mentally, so understanding what is the knee replacement process, what does it look like, what is the surgery itself, what does the recovery look like, how long should I expect it to be? What are some of the symptoms and some of the pain I might expect? Things of that nature. Preparing yourself mentally for knee replacement surgery and kind of the journey and the process that is involved. And then the third thing I say is preparing your environment. So making sure you have the resources at home to be effective when you come home after knee replacement surgery. That may be a walker or a cane. It may be certain exercise equipment that your physical therapist might recommend. It may be getting an ice machine if that's helpful, a raised toilet seat if that's something you might need, things of that nature to help set up your environment for success after surgery. The next question is, what is a knee replacement surgery? How long does the surgery take? So a knee replacement surgery is basically more of a resurfacing type of surgery. So the surfaces of your knee, so your femur, the end of your femur or your thigh bone, as well as the top part of your tibia or your shin bone, are both kind of shaved off or cut off the bone, and then the new prosthetic component is put over on top of that shaved off, cut off part of the bone. So basically it's more, you would think of it more of a resurfacing rather than a replacement of the joint itself. And also, oftentimes you can have a resurfacing of the patella or your kneecap, the backside of your patella or kneecap as well. And this is done with metal, titanium components. Also, there are some plastic components as well. There's what's called a spacer that sits on your shin bone, the top of your shin bone, to help restore a good spacing of the knee joint itself. How long is the actual surgery? It's about an hour and a half, 2 hours in length typically. I'm sure there's some surgeons out there who can answer that more succinctly, but from what I've heard, that's roughly about how long the knee replacement surgery will take. Now, are there risks for surgery, with surgery? And there are risks involved. Knee replacement surgery, again, isn't a perfect process. So some of the most common risks are blood clot formation after surgery, infection, either a superficial infection to the skin or around the incision, or a deeper infection of the joint itself. There's risks of prolonged pain is a risk. You may also have a risk of failure of the prosthetic, possibly loosening and failure of the prosthetic either in the short term or down the road. There are some other risks involved. These are some of the more common ones. Of course, there's many steps that are taken to reduce these risks and as much as we possibly can, but they are risks and there are things out there to be aware of. How are the outcomes from knee replacement surgery? So overall, the outcomes are good. The most common figure you hear or number you hear out there is about 80% of people in the end are satisfied with their outcome after knee replacement surgery. And that leaves about 20% or 1/5 of people who get a knee replacement who, for one reason or another, are not totally satisfied with the outcome. Now, that may be something to do with the replacement itself. Maybe they had an infection, maybe they had continued pain after surgery, or it may be something such as, not having realistic expectations, not having as much mobility as you might expect after surgery, and things of that nature, where the expected outcome and the expectations of the patient might not be in good alignment. But you want to consider maybe about 1/5 of individuals are, for one reason or another, not satisfied with the replacement. But on the good end of that is 80% or 4/5 in the end are happy with knee replacement surgery. Will I have a scar after surgery? And yes, you will have a scar. So the incision is made a couple inches, maybe 5-6 inches, right kind of down that middle front part of your knee through the kneecap. And that's used to, again, move that soft tissue to the side so that then the knee replacement surgery can be performed, the prosthetic can be placed, and then that soft tissue is approximated, enclosed, and sutured off. So you will have a very thin scar, and it really comes down to genetics. It's the main factor about how prominent your scar is after surgery and after the healing process. Some people may have a very, very thin white or clear line down their leg. Some people it may be a little more noticeable, and again, a lot of this comes down to genetics. What are the components made of? So I touched on this earlier. So there's metal components, so the component that goes on the end of your femur or your thigh bone, and then there's the component of metal that goes on your shin bone. There's also a plastic polyethylene spacer that's going to go on your shin bone as well. And then if the undersurface of your patella or kneecap is resurfaced, that's going to be a plastic component as well. What does the recovery look like? So the recovery after knee replacement surgery, you'll you'll have the surgery in the hospital. You'll either go home the same day as surgery, which is becoming more and more common, or you may stay in the hospital for a few nights. From the hospital, most instances you'll go home. Some people will go to an inpatient rehab facility if needed, but for the vast majority of folks, you'll end up going home after surgery. At home, you may have a few days of a week or two of home therapy where a nurse comes in, a home physical therapist comes in to help you with your therapy. This is for folks who may have difficulty getting to an outpatient facility right away after surgery. And then eventually you'll transition pretty shortly to an outpatient physical therapy, most times having 2 to 3 times per week of outpatient therapy for roughly 6 to 8 weeks, but a lot of people may go a little bit longer, and a lot of people may be a tad shorter than that as well. And it's going to come down to a lot of management on your own. It's doing your exercises, doing what you need to manage your pain, icing, taking your pain medicine as prescribed, things of that nature, and a lot of walking and activity as you start to heal and recover. I tell people you're not fully recovered when you're discharged from therapy after 6, 8, 12 weeks. Really, the recovery process is going to last up to 6 months, maybe even more than that, till you really feel completely recovered and back to normal. Will I need a walker or a cane after surgery? For a lot of folks, they will use a walker for a short time after surgery. If you didn't use an assistive device before surgery, you probably won't use a walker very long. If you used a walker or a cane before surgery, then you might obviously use that a little bit longer, maybe even long term after surgery. But most folks, if you didn't use anything before surgery, you might use the walker for a few days to a week or so, hopefully transitioning shortly to using a cane, and then hopefully going back to not using any assistive device. That's kind of the usual progression. Some folks get away from using the walker a little bit sooner. A lot of it has to do with your strength, your mobility, as well as your pain levels throughout those early phases of your recovery. How painful is the knee replacement surgery? It's pretty painful. There is a lot of pain and discomfort, especially early on after surgery. The good thing is that this pain subsides and decreases. You probably aren't going to be completely zero pain free. You may still have some episodes of flare-ups or stiffness and pain here and there after the surgery. But eventually the pain gets better, decreased in intensity, decreased in frequency over a number of weeks to a number of months. The good thing is there's a lot of pain management strategies out there. Of course, there's prescription pain medicine, but there's also anti-inflammatories, acetaminophen or Tylenol. There is the use of icing, there's physical therapy treatment, and a lot of different strategies to make sure that you can stay on top of your pain and manage your pain effectively after surgery. How long does the recovery take? I already touched on this a little bit, but usually that first phase of recovery I always think about is maybe that first week to 2 weeks where you're really in a lot of pain, swelling, sensitivity, stiffness. As you get into your physical therapy and start to feel better and better, usually from maybe 2 weeks to 8 or 10 weeks, is kind of that second phase where you're building up your range of motion, building up your strength, getting back into normal activity. And kind of that last little bit of recovery, maybe that last 20 or 15% of recovery, can really take a number of months. Again, it may take up to 6 months, may take up even to a year or longer than that to really feel 100% recovered. When can I get back to normal work, normal activities? It's going to be different for everyone, of course. If you're very active, very physically active, that's going to take a little bit longer to get back to. For example, if you have a labor-intensive job, you may take 10 to 12 weeks to really be able to get back to that job. If you have a more sedentary desk job, maybe 4 or 6 weeks on average to get back to doing that. Same thing with any activities. If it's something that's a little less intensive, a little more sedentary, you could probably get to that within a few weeks after surgery. Things that are more intensive, it's going to take 3 months, little longer than that to really feel like you're able to start to work your way back into those activities. But it's going to be person specific and also, of course, activity specific. And how long does a knee replacement last? We talked about this briefly. The original thought was think about 10 years, then they said 10 to 15 years, now they're saying 20, 25 years. Tends to be that knee replacements are lasting longer and longer. Obviously, these newer knee replacements, we haven't had them, for a long enough time to see how long they last quite yet. But our expectations are with improving surgical strategies, improving rehab and recovery, and management after the surgery, that we can expect a knee replacement surgery to last, up to 20, 25 plus years in some instances. Of course, there's again going to be a lot of variability. Sometimes the knee replacement fails for one reason or another. It loosens, there's an infection, things of that nature. But for people who don't have any of those red flags and are managing it and taking care of their knee and taking care of their health, you can expect about 20 years, give or take, that your knee replacement will last. So these are just some of the main questions. Of course, there's more out there. I hope you got some useful insights from this video. Again, please be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos. Please be sure to hit that like button, leave your comments, your questions below, and I'll get back to you. Thank you very much for watching.